Hi everyone, my name is Dr. Lauren Franz, and this is Dr. Scott Kollins, and we're here to speak with you today about living with COVID, autism spectrum disorder, and ADHD. So I'm a child and adolescent psychiatrist at Duke University, and I'm a faculty member at the Duke Center for Autism and Brain Development, where I spend most of my time working with young children and their families.
And my name is Scott Kollins. I'm a clinical psychologist and professor in the Department of Psychiatry, along with Lauren. I'm also the director of the Duke ADHD program. And about 4 or 5 months ago, at the beginning of the COVID-19 pandemic, Lauren and I recorded a video that we posted and shared with you all that was sort of initial reactions to living during a pandemic with a kid that has either autism or ADHD or both. And the challenges are many. We didn't know at that time how long that the crisis was going to last. We didn't know, we certainly didn't predict that we would be, in many cases, doing remote learning for many folks now. So we've decided to come back to you and share some tips and strategies to be thinking about as the pandemic persists into the school year. So Lauren will start off and talk about some issues pertinent to IEPs. And then I will talk about some strategies to help support remote learning.
Thanks, Scott. So what we're going to present on and sort of the structure of this is a short video, which we link with resources. We're certainly not proposing that we have all the answers. We realize these are really challenging times, but we do hope that you find this information helpful along your COVID journey. So COVID has been extremely disruptive in all of our lives. And I think this is particularly true for children with developmental challenges, including autism and ADHD. In a study of 8,000 participants, which aimed to understand how individuals with autism were coping with the pandemic, it was reported that 63% were missing key therapies and 90% reported worsening of behavior, mood, and anxiety symptoms. COVID has resulted in the loss of essential services. This is particularly true for children where school closures have resulted in the loss of services that are outlined in a child's individualized education plan or their IEP. In the spring, there was a quick transition to virtual instruction. Many schools and families understandably were unprepared for what happened and how fast it happened. School districts and families are still trying to make decisions where the best interests of the students are balanced with the health and safety of students, staff, and the communities in which they live. And honestly, we're all trying to figure this out in real time. What is working, what is not working. In the United States, more than 7 million school children receive special education services. And it's really important to remember that the Individuals with Disabilities Education Act, or the IDEA, and all its protections for students remain intact. COVID has not ended the civil rights protections or changed IDEA requirements in any way. School districts are still required to provide your child with free and appropriate public education. Your child's IEP should contain measurable goals that allow for child progress to be tracked. As the school year starts up again across the country, all school districts are trying to figure out how to do this. Important questions to ask may be, does my child need updated testing? Are there concerns for regression, which could suggest that changes need to be made to your child's IEP? Also with COVID, many planned IEP evaluations were delayed. If these have not been rescheduled, make sure you reach out in writing to continue moving this process forward. With the start of the new school year, many are hopeful that things will be better or easier than they were in the spring when there was such a quick transition to virtual instruction. There has been more time for everybody to prepare, and everyone is more familiar with the technological aspects of virtual instruction. There is also a recognition, though, that parents and caregivers are really, really stretched. Many are working from home or working out of the home as essential workers, which means that they're relying on other people to provide supports for their child during the day. Most parents and caregivers, importantly, have not been trained as school teachers or therapists. And right now, it's important to understand, based on your individual circumstances, what is realistic, and as best as possible, practice self-compassion during these challenging times. And very importantly, you want to partner and work collaboratively with your child's school if at all possible. Parents and caregivers need to ask for help, and the school needs to include parents, caregivers, and providers as they plan their way forward. It's important to identify the point person at your child's school. Is it your child's teacher, the EC director, the school principal, or somebody even external to the school, like somebody in the Exceptional Children's Division in the Department of Public Instruction? And reach out to this point person in writing. Share your experiences from how things went in the spring. What were your challenges during that time? What worked well? What barriers did you encounter? Was your child even able to engage with virtual learning and virtual instruction? That is all helpful information for you to document in writing for your child's school as you partner with them to come up with a plan. A potential silver lining of COVID is that home-based IEP goals can be developed and implemented. This can help build functional independence and generalize behaviors across different settings. As best possible, try to partner and work collaboratively with your child's school through your point person to understand your child's IEP goals and think about practical ways to translate these goals to the home setting. This approach could be particularly helpful for children who really struggle to engage with a virtual platform. There are many great resources available on how to make IEPs more relevant to the home environment, which we will share. But again, it would be best to partner and work collaboratively with your child's school on how to approach this school to home IEP translation, reaching out in writing and remembering you are not expected to do this alone. There are also strategies to provide structure to engage your child in virtual learning, which Scott will be talking more about. Remembering that most parents and caregivers have not been trained as school teachers or therapists and will certainly need support along the way.
Thank you, Lauren. There's so many just really critical parts of what you said in terms of thinking about IEPs, I think are relevant even beyond IEPs for how, as parents and caregivers, we think about providing support on a day-to-day basis for remote learning. And one of the things that I know you've heard this a lot, and I've heard this a lot, I've experienced this a lot personally, that we as parents and caregivers, for the most part, are not trained as teachers. And so we have to do the best we can. We have to keep in mind that we're not doing this alone. We have to not be too hard on ourselves. But that said, I think that there are some general broad principles that we can keep in mind to help support our children as they go through remote learning for however long that might be the case for wherever you're located. So one of the first things to keep in mind as a strategy to help support your child is the importance of routines. One of the reasons that all kids, and especially kids who may have particular challenges like ADHD or autism, one of the real benefits of school is that it provides a structured environment. It's predictable, you know what's coming, and there's a routine, and that's comforting and supportive to many kids that have the kinds of challenges that we're talking about today. So as much as possible to replicate that, or at least to try to set up some sort of consistent schedule for the school day, and also after school, can be really important. So that goes for sleep and wake times, meal times, breaks. I know various schools are going to be different in terms of when they're having the synchronous live learning as well as independent work. Try to stick to that as much as possible. And even when they're not in school, even if there may be break days or flex days, to try to maintain a consistent and general schedule, just so your children sort of get into that routine and can have that predictability that, again, can be sort of helpful for them in planning. And again, to reiterate something that Lauren mentioned, this is challenging. You may have two different children that are on completely different schedules, and that makes things more difficult. Do the best that you can, but keep in mind that anything that you can do to try to promote that day over day consistency and predictability. I mean, we're living in very uncertain times for everybody, and your children, the more predictability that they can have, the better. And this extends even after school time. So whatever options you might have available for their social activity, their play, their exercise, when they're not doing school could be important. And again, this is a really hard one, but if you can maintain limits on screen time, sometimes there may not be other options. If you have to work, if you have to have your child in the care of somebody else while you are leaving the home to go to work, but to the extent possible, think about, you know, what is their typical exposure to games, TV, screens, and things like that, and see if you can provide some limits on that. Similar to the sort of timing of school routines, setting up the environment can also be really helpful. So finding a workspace in your home that can be consistently used, not having your child do their schoolroom on their bed one day and in the sofa the next day and somewhere else the next day, but to have a consistent space that is theirs, that they associate with remote learning can be helpful. Planning ahead, thinking about how would I normally handle the school routine. I might have school materials ready to go the night before or laid out. I might pack a lunch for my child or be planful about meal breaks. That can both save time, but also can contribute to that structure and that flexibility. And doing what you can and what is feasible to try to minimize those distractions. I mean, we know that regular classrooms in-person settings are distracting, and that's challenging. And so you're not expected to have a completely distraction-free zone at home, but keeping it in mind to try to help to promote the kinds of learning that they're going to need to do. If it's possible, get some headphones, maybe different headphones for different children that might be doing different things. And if resources or access to those kinds of things is difficult, talk to your school and find out if there might be ways to get materials that would help support some of these the structure and the consistency that we're talking about. And kind of just to reiterate this, making the workspace with access to needed materials can be, I think, can be really helpful. This is sort of extending on something when Lauren was talking about using the home environment as a way to help promote specific IEP goals. But the home environment can be used to help extend and support and reinforce remote learning in a general way. These are different times. Our children don't have access to the kinds of ongoing, sort of informal discussions and access to things that they would normally have if they were going to in-person school. So trying to promote that, maybe you can substitute screen time or game time with having your child look up information on a preferred topic on the internet, sort of a mini research project of their own. Or that might be a compromise around screen time if it will keep them busy while you might have other things to have to manage. Then try to make it helpful to promote some outside learning, and engaging siblings in terms of that experience can be helpful as well. I've heard from a lot of parents that this has been an interesting time where siblings have had to learn to get along in ways that they haven't done before. That's certainly not the case for everybody, but promoting that could also be a good way to help push forward and keep moving some of that social development. So trying to be creative about how can I use the home environment here to promote and extend the kinds of things that my child might be learning in school. As we've mentioned, you are not alone, and it is likely that you're going to have ups and downs throughout this journey of, I like the way Lauren talked about the coping journey, and concerns are likely to come up, and especially having a child that might have some unique needs, that's going to be important to reach out. Getting a clear sense of what the concerns might be is important, and can help you talk to the appropriate people at school, whether it's a counselor or another special education teacher, or also a pediatrician or mental health provider, getting a sense of what might be happening to, that's causing a particular difficulty, collecting a little bit of your own data on that can be useful, and trying to communicate with teachers. I know this is a huge challenge because teachers themselves are still learning how to navigate the process of staying in touch with the parents of 20 or 30 different children. But be persistent and know, going back to what Lauren said, you have you actually have legal rights to make sure that you're getting things that you need to provide education for your child. So keep that in mind.
So thanks for that, Scott. So again, just to summarize briefly what we've been speaking about for the last 10 minutes or so, remembering, as Scott said, the IDEA remains in place. COVID's done nothing to it. Children are still entitled to an IEP if they need one, which should be implemented with the help of the school. Just remembering to reach out to your point person and work collaboratively to support your child as best possible. I always encourage caregivers to reach out in writing. Documentation is really important. And also just remembering that routine and structure really help children in this challenging time as well, and help families, and that there are ways within our home environment to think creatively around promoting learning, and that there are resources to actually translate school IEP goals to the home environment. And then lastly, as best possible, trying to practice self-compassion and self-care during this challenging time, and remembering that you're not alone and reaching out when necessary. And I think our next installment is actually going to be about self-care and sleep. And this is sleep not just for children, but for adults as well, because we all function as a unit. And if somebody is not sleeping well in the house, nobody's sleeping well in the house. So thinking of strategies to come together on that.
Yeah, and as you view this on our various social media platforms, I would also invite you to contact us at the contact info that we shared a moment ago. And if you have ideas that or needs for topics that you would like to hear from us about, please let us know. We want to. We've recognized the need to continue to have to be with you on this journey and to provide some info from what we know. And we're happy to kind of keep this going as long as we need to. So thanks everybody for tuning in, and we'll see you next time.